Managing Director, Victoria University Medical Services, Dr. Kiraga Kotech says diseases like the deadly malaria and HIV affect the social and economic well-being of people, yet they are easily preventable. Malaria is the leading child killer in Africa.
We also have two ultrasound machines here. These are two-dimensional ultrasound. Focusing on preventing. So that is how we are trying to set ourselves different. We are offering health checkups. People coming in, we call it an MOT of the body. If you get your car serviced regularly, we suggest you should do the same for your body. Get yourselves checked.
On non-communicable diseases, he says their priority is on early detection.
We are trying to promote a lot of non-communicable diseases. The primary focus of the last sort of 10 or 20 years has been on HIV, malaria. Yes, that focus should still be there. We should still keep fighting that. But we have a ticking time bomb on our hands. We've got things like diabetes, high blood pressure, which, as the population is becoming unhealthier, sedentary, we're seeing a lot more of that.
The medical center will implement an outreach program to take medical care to low-income people. But they are concerned that there remains a weak link between government and private sector healthcare providers that needs urgent redress.
We should be supporting the government, and government we should be supporting us, vice versa. Ultimately, we need to be able to provide quality and affordable healthcare to everyone.
Dr. Kotech raises the old age question on the shortage of doctors and other critical medical workers and poor remuneration, saying these have affected the quality of healthcare in the country.
Good quality trained doctors coming out from Mulago, but we just don't have enough. We have issues about public servants, or what you call them, not being paid on time. It demotivates them. Their salary, I would say, sometimes is insufficient to cover their lifestyle or quality of life that they would normally need, especially living in Kampala, for example, where things are just getting more and more expensive.
Victoria University Medical Services looks forward to expanding into hospital in 6 months' time to serve more people.
I want you not to bite the tongue, but the spoon can kill the child.
Meanwhile, private health service provider AAR is moving to prevent death in residential areas that accrue to poor first aid. The organization has begun training housemaids who spend a lot of time with children at home when their parents are at work.
It's a suggestion from the clients, the staff, and the people we serve as an emergency operations department, as a call to look at the small problems that the maids who remain at home and look after our children are unable to manage or help out in case of simple emergencies.
The training was held at AAR head offices in Kololo, Kampala. 7 housemaids were trained on basic first aid in case of burns, sudden attacks, and electric shock, especially in children.
After the child, including helping the child when the child has a problem. For instance, if a child is running and falls, there will be bleeding. Is the maid able to stop or control this bleeding before maybe this maid can give you a call to say what? Child so had a fall and the problem was this, I did ABCD.
KABBALE, Ivan Elvis, NBS Television, Sunset.